Well, good afternoon. As she said, I'm Colleen Costello, president and co-founder of Vital Vio. What I want to talk to you a little bit about today is the increasing public health challenges associated with the germs that are all around us, and a really interesting convergence of our knowledge of microbiology, as well as the evolution of the lighting market that's created a really unique emerging technology to address these germs in a variety of different environments. So we're all familiar with some of these nasty germs you see behind us, and hopefully the most dramatic experience you've had with any of these is something like the common cold or flu. However, in a lot of cases, it can be more dramatic, not just a minor illness, but be something that can be life-threatening. Now, these germs are actually crucial to regulating human health. However, when we run into challenges is when these germs become pathogenic or harmful to humans interact with. A lot of the driving factors behind why these pathogenic germs are a problem is the speed and ease at which they can actually travel throughout a facility, as well as their ever-growing antibiotic resistance. Now, the World Health Organization has cited antibiotic resistance as on par with climate change, as well as one of the largest threats of the 21st century. If you take that into consideration with the fact that the tools that are currently in our arsenal are most commonly intermittent and always harmful to be used around people. So those are what we're really working with right now to address these challenges, which is relatively limited, creating quite a conundrum for us in a public health sector. So now you see there in one of the images where these germs can actually reside. So we have any of these types of surfaces that we're all touching any day. I'm sure you've all touched a couple dozen doorknobs today, or faucets, or anything you could imagine that would harbor these types of germs. So we have, that really is defined as environmental contamination around us. Then of course humans are interacting with those environments. It could be in your home or it could be in an operating room. And this is actually transmitting germs throughout that facility. And it has a variety of problems associated with that contamination. You can see some of them there depending on where those germs are going to get. And again, we can't see these on surfaces. So adding some more confounding factors to this is that these germs that we cannot see on these surfaces in some cases can last days, weeks, and months on surfaces. Then we take a look at a study that sampled over 100,000 different objects, anything ranging from an ambulance to an operating room. And what they found that the typical daily cleaning that they're doing in these environments, so those are typically chemical cleaners or soap and water, is actually only getting about 32% of what is on those surfaces. So that's a little bit scary to think about, because now we have that other 68% that's growing again days, weeks, or months on any of these surfaces, and you can't see them. So it's not surprising to see that we then have widespread challenges in a variety of different types of facilities. In the last year, we've had contamination in ice cream factories, chicken processing, endoscopy surgery centers in California, UCLA, Sinai, compound pharmacies that have contaminations. We have career-ending NFL athletes that are getting MRSA infections in their locker rooms, also resulting in tens of millions of dollars of lawsuits associated with these little germs that we can't see. So that's hence why we have these widespread challenges as all of these factors right now. So the most dramatic effect of this is actually the leading cause of patient death in the United States, which is infections that are acquired in a hospital. I personally experienced this when my grandmother contracted a MRSA infection when I was about 20 years old, and I was naive enough to think that people who go into a healthcare facility end up better when they leave, and in a lot of cases, about 1 in 20, that's not the case. This is adding between $35 and $45 billion in excess costs to the healthcare system every single year. And this is something that every hospital is paying a lot of attention to for a number of reasons. One, the reputation of hospitals is increasingly transparent. We can all actually go to Consumer Reports right now and look at all the hospital infection rates in the capital region and make decisions where we're going to get our care based on that. Healthcare facilities are not actually getting reimbursed or paid when an infection happens because they're considered preventable within these facilities. Now even government regulations are coming into play in the Affordable Care Act that's putting penalties on these hospitals because they are such a preventable illnesses. However, our tools are really limited to address these types of germs. So what are we doing about it now is a really relevant question. I mentioned some of the chemical cleaners that unfortunately in practice have limited ability to really get those high percentages that we need to clean these surfaces. So there's been an emerging field of remediation technologies that are using very harmful systems that have to actually shut down environments. It can be a patient room, a locker room, compound pharmacy, and the variety of uses they have are for huge chemical bombing, for example, or pulsed ultraviolet units. And the biggest limitations that our team of engineers, when we founded, saw was that these are one-time solutions that are disinfecting environments when no one's actually in there. So it's great, they're great at killing germs, and they're great at remediating environments, but unfortunately then when you have the 10-day stay that a patient is in a room, these systems are sitting in a closet. So as soon as normal course of operation, whatever it may be, is occurring, we're getting continued redeposition of germs throughout that environment. Then again, transmitting, they're living on surfaces. So these have their uses, but they are again somewhat limited. So that's where we really started to look at what types of ways can we use pervasive systems, any types of technologies, in order to address these challenges given all of these confounding factors that we determined. So we started looking into germicidal lighting. Now UVC lighting, as you can see there, which is within the spectrum, I don't know if I have a clicker here, but you can see UVC is emitted from bulbs. So it's excitation of a gas, and it actually is very good at killing germs. It's able to penetrate to the DNA of germs and render them useless. This has been around for decades, is used in a variety of different settings for air filtration, water filtration, as I said earlier, the pulsed UV systems. So this has been around for decades because bulbs have been around for that long. And we are able to actually very effectively emit out of these gas bulbs this UVC wavelength. However, it's harmful to be used around people because it also penetrates into our DNA. It's the same concept of a sunburn, for example. Why that's of concern, why you need to wear sunscreen, is because of these ultraviolet rays. So then we started looking at, okay, well, the premise of lighting to kill germs is something that has been around for a long time because you can deliver dosage through lighting. You can really deliver energy and affect these germs. So at the same time, the commercialization, of the LED industry was up and coming. When my co-founder and I entered college, you could not get a commercial LED bulb at Home Depot, for example. Now I'm sure you've all seen those out there and available, perhaps purchase them. And so what LEDs do, and I'll talk about that in a little more detail in a minute, is allows us to use the more ranges of the visible light spectrum. So what the visible light you can see there in the image is really commonly known as sort of the Roy G. Biv, so what we can see of all the different types of colors. We can more precisely use these wavelengths of light to perform different functions now that we have the ability to use LEDs. So again, really the advent and commercialization of LEDs is incredibly relevant to the technology we use. It's a new form of emitting light, so as we've all been familiar with incandescent and fluorescent, LEDs is now a new way that we can actually emit light through semiconductors. Some images shown there of what that looks like. It can be much smaller than a thumbnail, actually, we can emit light. Now, the way that this works is relevant to, again, getting back to how we're going to address these germs on these surfaces. So you can see in one of the images there under a fluorescent bulb, which again is excitation of a gas, you have somewhat of an erratic spectrum that's coming out of that bulb. Now, it appears to the human eye as white light because all of those different areas come together to create white, but because it's excitation of a gas, it's quite random. Now, what we can do with LEDs is actually much more precisely tune areas of the spectrum. So you can see there a particular color LED that is a much more narrow bandwidth that can actually perform functions. So what we looked at, and what a lot of the research showed, is that if you can actually more narrowly use the spectrum, we can more narrowly target molecules in different ways. So you can actually target molecules that are in germs that are not in people, and actually affect them in different ways than it affects our human cells. Now, if we only had the technology of bulbs or incandescents, for example, we wouldn't be able to actually use such a targeted area of the spectrum. So again, this is sort of the convergence of a lot of things happening at the same time. But what's actually really interesting to me is that the emergence of visible light disinfection, this understanding, actually dates back to 1892 in London, where H.M. Ward was using filters over sunlight to look at how different areas of the spectrum are actually affecting germs. So the sun is a broadband spectrum, has a lot of the light coming out of the entire spectrum. So what he did at that time had no light source to emit different areas of the spectrum uniquely. But what he could do is he could filter out different areas of that spectrum. So you can see in one of the images there, what he actually did and determined was that in the 400 to 420 nanometer range, which is really a blue-violet hue that you would see, he filtered that out and created an E within the filter and then grew bacteria underneath it. And what he determined, you can see in the second picture there, is that actually that blue-violet area of the spectrum that he filtered out was germicidal. It actually killed germs. And he did that with all sorts of other areas of the spectrum too, but found that this was the unique bandwidth that was doing this. At the time, microbiology practices weren't far enough along to really understand any of the molecular processes, and he also had no way to emit just the spectrum other than filtering sunlight, but made this determination, which is, I find really interesting. Now we fast forward over a century later, and we have the advent of LEDs in the late 20th century, and now really the commercialization so that a lot of different lighting companies can do what we call sort of custom spectrum engineering. So what you see there is a variety of color LEDs, for example. As I said, we can now pick wherever in the spectrum we want to use and emit from a semiconductor. We can put them on printed circuit boards and make them very tiny. You can see there under the size of a thumbnail. And then what we use is lighting science associated with the chromaticity diagram that you can see there. Basically somewhat analogous, although it's a little more complicated than kindergarten fingerprint, right? We put together different colors to make other colors. And really, if you want to illuminate a space, you try to do that to make white, which you can sort of see in the center point there. So we have a lot more flexibility now with how we're designing custom spectrums, with all of these factors coming into play. So now with the commercialization of sort of these aspects of custom spectrum engineering, we can do all sorts of interesting things with lighting and health that we could never do before. So, right, you pop in those T8 fluorescent bulbs in your office building and that's it, you forget about it. You pop in your incandescent bulb at home, you forget about it. That was previous. Now we have all sorts of different opportunities to affect circadian rhythms, which is incredibly important for human health. What light you see in the morning and the evening really affects how your body regulates a number of different systems. So we can now custom tune warmer in the evening, cooler in the morning to help promote human health. There's also been research to show that we can prevent illnesses like Alzheimer's and dementia by viewing different types of lighting at different ages of your life. Plant growth can be heavily affected. We can increase the efficiency of plant growth or have different types of nutrients higher expressed in different types of vegetables through the types of lighting. And then of course the disinfection aspect, which is where our company focuses on how we can custom spectrum design LED lighting to affect these germs that are all around us and causing the problems I discussed earlier. So that's what we've really done actually, is we've taken a convergence of all of these different factors and research and information and developed a visible light system to disinfect rooms and environments that are facing the challenges I discussed earlier. So you can see there that we take that blue-violet area of the spectrum, again determined back in the 1892 that it can actually kill germs, but now we can emit it with LEDs. We custom spectrum engineer a white light system that is actually masking that. So what you can do is just by flip of the switch, you can actually illuminate your room, so you can be performing a surgery or compounding drugs or using a locker room with white light, but it's actually uniquely dosing the room behind the scenes. And the way it's doing that is targeting these molecules that are very specific to these germs called a porphyrin, and it creates a reaction that is toxic. We don't target the same thing in human cells, so no reactions happening, hence the safety of what we do. So this is a little bit of a summary in terms of what we're able to offer. So the biggest limitation we saw, as I said earlier, was the consistent aspect of cleaning. The fact that we have things that are intermittent and harmful are a huge challenge in tackling these germs. So we can now consistently be reducing the bioburden in these illuminated environments, and it's safe to be used around people. And then of course we have the aspects of LED lighting, longer life and efficiency and things like that that are associated with the general LED industry. And this gives you a snapshot of what we can offer within a room environment. So if you look at the top row there, for example, this is if you imagine you walk into a waiting room, one cough on a surface, one shed of someone who has staph on their skin, and then you get, not even a whole day later, you're seeing exponential growth of these germs. It is a little disturbing to be able to see that in a petri dish, because you're sitting in a waiting room, you can't see that. The fact that we have media, you can see it, but this is what you're seeing all around you. And that's with your fluorescent lighting, which is doing really nothing for you right now. And then we show with installation of our lighting, we're able to, through again this narrow bandwidth excitation, we can have all the bacteria gone over the course of not even a whole day. So it makes a really big difference for these active environments that are of concern. And this research was actually done over at RPI in Troy. So we have a lot of data to support what we do, as well as the safety efficacy associated, because that's everyone's first real question is, if it's hurting germs, how is it really safe to be used around people? And again, that is because we can so narrowly target these molecules, and we have all of our international certifications for it. And we can install into right now any standard drop ceiling that is in a commercial environment. What we also get with LED lighting and this custom spectrum engineering that it's not unique to our product, but a lot of other lighting companies do well, is a higher what's called color rendering index. So you can see in the top picture there, I don't know if you've all experienced probably a poorly lit office space that's sort of some dingy fluorescent lighting and it kind of looks dull, not very pleasing. Some people actually get headaches associated with it. Well, now that we can actually use custom areas of this Roy G. Biv spectrum, we can actually make colors pop a lot more and have the color rendering increase as well with the use of these LEDs. And there's an example there of how you can see that. We're also working with a lot of organizations throughout the country. We're heavily funded by NYSERDA in New York State, who's been a great partner for us. And we have a number of implementations and publications coming out of uses in different environments. We found in Mount Sinai that in an active patient clinic, for example, we were able to show reductions on all surfaces morning and evening, even with hundreds of patients throughout that HIV clinic over the course of a week. So we're thinking somewhat, in the future here, 5-10 years down the road of what we may be able to do with this technology. And we have iterations and advancements right now that allow for a higher use of this technology in different environments. So we've really boiled down our technology to be a single diode that can implement into any of the light fixtures that you see above you. So going to a screw-in bulb in your home, if you would like to, for example, use it in your shower to prevent mold, if you have a new bathtub, we can do that. We're also looking at designing products for airlines, so airline bathrooms, if you could imagine, which I think I see everyone's face is a little terrified of. That was the most head nodding I got. So that's and then we also have the software aspect associated with controlling LEDs because they are semiconductors. So we can do all sorts of things. We have timers, occupancy sensors, and of these things that we're now afforded with using a semiconductor technology. So what we're really here as a company to do is to provide cleaner environments given all these challenges we face. Each of these examples here are places that we have installed or are soon to be installed in to really help provide a cleaner environment for these things that are at risk. So thank you. I hope you enjoyed learning a little bit about some of the challenges we face and some of the new things that we can afford as a society and as a company, and hope I changed a little bit the way you think about clean. Thank you.